All right, let's see what's happening here. All right. All right. Hello, everyone. This is Christy with Hemp Your Health, Director of Education at Seed to System. And today we have two heroes on, Dr. Baben Babek and Dr. Jack Yu, who have pioneered a study about CBD and COVID-19. I'll do a quick introduction for them since today is really important, and then I'll let them take over. Dr. Baben Babek is a professor of immunology and associate dean of research at the Dental College and Medical College of Georgia, Augusta University. He has been pioneering medicinal cannabis research with Dr. Yu since 2014, and he is a member of the International Cannabis Research Society and the Medicinal Cannabis Europa Association. He has over 100 peer-reviewed papers, and it is a joy to have him on today. Dr. Jack Yu is a professor and chief of pediatric plastic surgery at the Medical College of Georgia, Augusta, and his clinical interests include aesthetic surgeries such as facelifts, eye lifts, nose jobs, and lip augmentations. The doctors have been collaborating on studies since 2012 and medicinal cannabis since 2014. Thank you both, doctors, for being on. This is a very important and incredibly serious topic we're talking about today. So your expertise is pivotal. Before we get into the study itself, I was hoping that you both could share a little insight about what COVID-19 is. This is not the first time a coronavirus has affected humans. So what makes COVID-19 different than other acute respiratory distress syndromes or something like SARS that we've seen in the past?
Good morning. I'll get started and thank you for having us. COVID-19 is coronavirus disease 19 for 2009, starting at 2019. And it is not the first coronavirus to cause human diseases. Over the years, there's SARS and there's MERS, and this time is the SARS-CoV-2, which is similar to this, and this is a model magnified about 1,000,000 times. And the reason why we call it coronavirus is because it has this corona seen by electron microscopy, and these black spikes representing some special kind of protein that will bind to the doors, if you will, of our cells, and then be able to open the door and actually get into the cells. And it is different from the other coronavirus in that it is a lot more infective and can be transmitted to a lot more people. Both MERS and SARS have not reached anywhere close to this degree of general infection. Inside this virus, which is very, very small, even though it is the largest of the coronavirus, it's only about 100 nanometers in size, which is when you take 1 meter, which is about the length of my arm, and divide it into 100 million times. That's a nanometer. Inside it is an instruction tape, like your computer tape. And it only has about 30,000 letters. And within that 30,000 letter, it is very, very efficient in doing what it needs to do, which is taking over the entire function of the cell. And it does that with great efficiency, shuts down the early warning systems and blocks the communication with the neighboring cells that Dr. Babin will go into more details. And towards the second part of the disease process, rather than become not responsive enough, the disease kicks into an overdrive and produce too much of the response. And the body actually causes damage to itself through its own response. And that's part of the problem with this disease because it is extremely variable. Some people get it in the lungs, other people get it in the brain, some people get it in the blood vessels. You can have in the GI tract, some people have diarrhea, and you can have clot formations because this virus can attack the lining of the blood vessels. So you can have situations where you develop clots in the lungs or clots in the blood vessels. People have required amputations. So it is a very, very variable disease. If you're younger, you're not going to be as problematic. This, for example, is a graph taken from the Georgia Department of Public Health. And if you go to those kind of websites, you will realize that right now, the biggest group of people that are having the disease is the young people, 18 to 29. And out of some 60, 70,000 individuals, the mortality rate is extremely low, maybe 50, compared to, say, at my age, if I get it, the outcome will be much worse. So I think the take-home message is that it's a new coronavirus causing a very, very variable spectrum of disease ranging from pretty much like a cold to all the way to spending days in the ICU and end up dying. So I'll hand it over to Dr. Babin.
And just, this is great, Dr. Baban. So just to confirm, we hear you correctly, Dr. Yu, the coronavirus is not just affecting the lungs, but it can affect or attack the blood vessels, the heart, the brain, the gut. It's not just targeting anywhere, but the immune system's reaction can be overdrive and hijack, which increases the inflammation of wherever it's going.
That is correct. It can attack your brain. That's why people cannot smell nor taste because it's attached to the nerves. It can attack your lungs. It can attack basically anywhere you have that ACE2, ACE, which is angiotensin converting enzyme type 2. That is the door through which this thing can open. And anywhere you have the door, you can get in. And you have that door all over the place. It's just a matter of usually it is through the lungs because that's how you inhale this material. And it can spread by airborne.
Got it. Wow. Dr. Baban, thank you, Dr. Yu.
Thank you, Christy. So just to add to that question, Dr. Yu explained it, just to add to it, basically the virus, they are very picky and kind of rude guests, basically. So when they get into the, when we are exposed to them, they are very specific on the location they pick. So the lung is what is called primary site for the virus. And then from there, if it left untreated and if it can basically overcome the immune system, beat the immune system, then it can go to the other tissues too. I mean, that's one aspect of it. But regarding this virus and its interaction with our immune system, really, as I mentioned, and as Dr. Yu mentioned, so the virus, as soon as we get exposed to the virus, it goes inside our body. And first of all, it is like a person who looks for a place to stay and see if he can the virus likes to feel like home. So when it picks this tissue, in case of coronavirus, the lower respiratory system, basically the lung cells, it uses the ACE2 as an entrance. Basically, it has somehow it has the key for it. So it gets into the cell. As soon as it gets to the cell, since I mentioned they are very aggressive and rude guests, they like to take control of the host. So they try to basically hijack the brain of the cells in our body, and which is the nucleus there. So they unload their luggage, which is their nuclear material, basically. They unload every luggage in our cells, in our body. They mix it with our own furniture and everything, which is our cell, basically. They mix everything and they create sort of chaos for us, but a very organized attack for themselves. So that is how they basically mix their own genetic material with our human genetic material. And that is when our immune system, which is trained to keep eye and survey our balance in our body, realizes there is some problem there. So that is when the cell, infected cells, send the signal out to to our law enforcement, which is the immune system, and says there is a chaos here, there is a criminal inside this cell, inside this house. And they start, basically the immune system start reacting to the signal. So usually, in many cases, even in this case, immune system can basically overcome the threat. They can destroy the threat, and they can arrest the criminal, which is the virus here, and basically get rid of the problem. And again, the order and the balance comes back to the body. However, in very few cases, which is the problem here, it is a serious problem. About maybe 10 or 15% of people who get involved with this, it basically immune system can react to the virus, but it is not enough to get rid of it. So the virus uses the anarchy and the disorder which has been created in the body. So this continuous what we call it, basically the imbalance in the body creates a situation which we call it inflammatory status, basically. And because of the consistent presence of the virus, replication of the virus, the body starts reacting to it. And then, as Dr. Yu mentioned, when it basically goes on for a while, usually more than 4 or 5 days, and then that is when the body enter a chronic inflammation, and then we have continuous damage to the host tissue, which is our tissue, basically. So specifically for this, when this situation with the chronic inflammation happens, then the body basically, the cells have a way to communicate, like human, we communicate with our language. The cell communicate with certain proteins, which is called, the famous one is called cytokine. So cytokine is the language for the cells, which they speak with each other, the immune cells. So they start production of these cytokines. Some of them, we can divide them to 2 groups. Some of them are inflammatory. They want to boost the immune system. And some of them, they want to control it. They want to bring it down. So they work together to keep this balance in our body. But the inflammatory one, the type 1, which the cell start production of those because they keep sending signal between the host cell and the immune system. They are called, as I mentioned, cytokines. The famous one, for example, in this disease is called Interleukin 6. Interleukin, inter means between, leukin is Latin word for white, so it is between white cells, which is our defense system. So the interleukin 6 is the famous one. For example, we have interferon gamma. Those are the inflammatory cytokines which are produced. And then when we have the overproduction of these cytokines, that's what the problem is with this disease. We call it cytokine storm. Means it has gone out from the balance. It is like a storm. It is like a hurricane. And they are very destructive. They have to be produced in a tiny amount for a short period of time. But in this disease, they are produced in large amount for a long period of time. And that is when the tissue, lung, heart, gut, all of them get hurt because these proteins are very destructive, and virus uses this destructive mode, and then basically it hurts our body.
I love this. So the chaos that you were explaining is from the interleukin 6, the cytokines that are destructive, and they've sort of gotten out of balance. And that's what's causing the inflammatory damage first in the lungs, and then in the susceptible tissues or blood vessels or gut, heart, lungs, brain, etc. So once the immune system says, all right, overreact, that's like more law enforcement than we need, doing, the intention is to do the right thing because the immune system is there for the right reasons, but too much of a signaling,
exactly,
more inflammation, and then we have that cytokine or inflammatory storm, which is just excessive and destructive inflammation that can jump from the lungs to other parts of the body.
That's very correct. Yes.
Thank you. So I hope everyone is on the same page. COVID-19 is a more serious coronavirus because it's more infectious, like Dr. Yu was explaining, and that the immune system is actually trying to do the right thing by sending in more troops, but actually that's causing more excessive inflammation or destructive inflammation. So Dr. Babam, you said that you saw an urgent need for better intervention and treatment strategies, and that perhaps this is what led you and Dr. Yu to do the COVID-19 and CBD study, which has gotten a lot of attention, including the World Health Organization has published this because it is pivotal that we look for interventions that are natural and that the treatment itself isn't causing more damage. Can you please, both of you, please explain some of the markers that you were looking at when you started this study and some of the results that you found from using CBD for this rogue inflammation attacking our systems from COVID-19?
Sure. Good. So I will start, and then Dr. Yu, I think, will complete it in a clinical way. So this disease, the COVID-19, we can divide it to two sections, really. One is when we are exposed to it and virus is in our body. And when basically it is stabilized in our body and created the disease, and immune system has failed to stop it in the first place. So what we looked at it, because we do not have really the facility currently for using the actual virus from the beginning. So we went to the end stage. So we mimicked the situation exactly how this, after the entry, when the virus has entered our body and when it has created the disease. So we took it from there, basically. So we went to the end stage. And because at that stage, really, there is no, Dr. Yu will mention more, there is no good treatment right now. There is no definitive treatment right now, but supportive treatment for that stage. So
Not in the extreme case.
exactly, in extreme cases. So for that, there is as I mentioned, those protein cytokines like interleukin 6. We looked at it. We looked at like interleukin 17. We looked at interferon gamma. And then this virus, the other thing it does, it basically energize and basically make our T cells, which are the main white cells against viral system, viral infection. So it makes them really silent. It makes them either to go through the kind of suicide, or it makes them do nothing. So that is a situation which in a clinic, Dr. Yu will mention it, is called lymphopenia, means the lack of those lymphocytes, the T cells. So we check the T cells also in this to see if our model, first of all, has created the same situation and if any treatment and intervention can improve it. So we looked at the T cells to check the lymphopenia. We looked at the white cell. Majority of them are called large cells, are called neutrophils. We looked at them, so we saw the increase of those numbers. So we looked at the cytokines, we looked at these cells, and yes, those were the major one which we looked at it really. And then we noticed that with the treatment of CBD, and of course we looked at the tissue, the gross section of the tissue to see if there is a destruction in the tissue, structure of the tissue, morphology of the tissue. So
the lung tissue in particular?
The lung tissue, yes. And then we noticed that our model has mimicked the damage by the virus. And fortunately, it was very encouraging that we saw the CBD. We use a very specific dose of the CBD, isolate CBD, which helped basically reverse these side effects of the virus, of the infection. It brought up the T cell. It basically, that lymphopenia was not there anymore. And then also we saw the improvement in the number of the granulocyte, the neutrophils went down, and the structure of the lung was good. Cytokine went down. So those was a good thing. And now I think Dr. Yu will add in the term of the clinic.
Yes.
So just to supplement a bit, when you say the COVID-19 is more serious, that is true in the sense at the population level, it is having a lot more people dying as a result. But at the individual level, the lethality is actually less. So MERS and SARS, the virus was able to cause death of the patient rather rapidly. So you cannot propagate the virus. This virus has hit the sweet spot so that it continue on. It has this period of asymptomatic spread period, so that you get the virus, you're spreading the virus, but you yourself don't have the symptoms, fever, and so forth. And that's part of the strategy that the virus uses to silence the host defense system. A lot of the virus can do that. The decrease of the lymphocyte, for example, is a hallmark of HIV/AIDS. The SARS-CoV-2 use very similar mechanisms to decrease the number of these guard defense cells in the body. And the model that we used, as Dr. Babin mentioned, I want to stress that we did not use the virus itself, because that requires certain level of biosafety measures. We bypassed that. We went to the component that the virus produces, and then the body reacts to that will cause the lung damage. ARDS, the A used to be adult respiratory distress syndrome compared to the infant or neonatal because both at the very fine level, you see the ability of getting oxygen into the system become reduced. That's because you need to have very thin membranes to allow the exchange of gas. And one of these material that's being produced as a result of this fighting the infection is called a hyaline membrane, which is sort of a pink looking gooey stuff that you fill your lung with. And you can imagine if you don't have a very delicate intact membrane system to exchange the gas, your oxygenation will go down. And in our model, this oxygenation decrease is quite dramatic. And it is one of the markers that we saw returning partially to more normal level. And the many things that we do, we choose to do, breathing is not one of these things that we choose to do. We have to do it. And when you no longer can do the gas exchange, and that's a major problem. And that's one of the first site that the cytokine storm causes damage. These cells come out. It's like if somebody comes to your house and have a fight, it doesn't matter who wins the fight. Your furniture, your living room is gonna be destroyed. And that's the same thing. Unfortunately, you cannot afford to have the lung being destroyed. So the many markers that we use, we bypassed the initial phase and we went to the part that the virus induces this a tremendous of immune response. And then we show that the cannabidiol is able to restore some level of this balance, which is very nice.
This is beyond promising for a lot of people that are listening. And just to give you a little update for our listeners, in the Facebook post, I've put both studies, the WHO, what the WHO has published, and another scientific journal of their study. And they replicated this virus, and you can read about that in their study, in mice. And then you injected them with the mice, you injected the mice, and then after 2 days or something, you started the first CBD treatment. And then you did a total of 3 CBD treatments.
Yes.
And then within those 3 CBD treatments and even days afterwards, you saw improvement in oxygen levels, the structural damage in the lungs improve, and temperatures that were indication of immune response return to normal. And then these results lasted even days later, which is more promising than a lot of other treatments that we have been hearing about. Now, what if we've gotten some questions here on the Facebook Live about, well, first this is great information. Thank you. You two are heroes and pioneers in this COVID-19, which has left a lot of people very fearful and some people even hopeless that they can't go out and have a normal life. So for the people that are healthy and below the age of 60, 65, is do you think it's good for them to be, to have this, to create that herd immunity so that their immune system is actually functioning and can protect themselves? Is one question. And the other question is, what about people who have autoimmune conditions and have overactive immune responses to begin with? Are they more susceptible to COVID-19?
You want me to? Yeah. So I go back from the second one, really, the autoimmune disease. It is short answer is really we don't know if the autoimmunity how it is, because we have a few studies which, for example, have shown not specifically the autoimmune, but for example, people with asthma or people with autoimmune like lupus. We have a few studies which say they do worse because it contributes basically to that cytokine storm. However, we have few that it says the body already have experience this chaos in the system, and they are better handling the situation. We don't know really how it is, but it needs more investigation really to know exactly what it is. But there are different school of thoughts and different investigations, so we have to wait for that. For herd immunity, really, I think more Dr. Yu can talk about it, but in general, this is not because of the transmissibility of this virus and high replication, really. I don't think we can afford to wait for the herd immunity, and I don't know really how effective that would be and how long, because we don't know really how long does it take. We don't know the how the statistics we get from all the world, because this is a pandemic. This is a world problem. It is not only that we control the US and then, oh yeah, everything would be good. No, because this is, we have a small village now called world, really. We are all together, living together. So I don't know if herd immunity anymore is an effective way we can wait. We can afford to for something like that.
No.
I think the key word there is afford, because herd immunity eventually will happen. You go look back in human history again and again and again, this sort of thing happens with some frequency. In the 1300s, we have the plague, the bubonic plague. Eventually, herd immunity did develop, and we got through that. But it took years, and about a third of the entire population must die. In 1918, we didn't have this kind of capability. The H1N1, we developed herd immunity about a year and a half afterwards. And literally tens of millions of people died. And yes, we can have herd immunity, and that's the natural way of dealing with this sort of intermittent infections, and it will always be with us. The problem with this is that too many people must die, and that the virus changes. Yeah. It's a ever, going cat and mouse game. So we develop antibodies, we develop the ability to detect this thing, and then we try to kill it, but then that thing changes. So it is unclear at this juncture. I think herd immunity it's going to happen. Just hopefully that it will happen sooner, without the loss of a massive amount of lives. Now, with regard to young people, yes, it is true. Young people can go out there and you can get the disease, and you are probably going to do a whole lot better with a much, much lower what we call CFR. That's the case fatality ratio. That means how many people get and die. The problem is that the young people can go home and give it to your mom, give it to your dad, or give it to your grandma, and you will continue to keep the daily cases high. And the key, I think, right now is to stay below the healthcare's capacity. If you exceed that, then those people who shouldn't have died will die. We need to have ICUs. Georgia, for example, has 590 ICU beds. This week alone, we're going to have 100 people exceeding that capability just because we have a lot of cases. And that is a problem. And if we can decrease the sort of the vigorousness of the virus, then physicians can deal with this. And we need to just sort of be smart about it and get through this. And we will get through this.
I love this, and I love the how powerful CBD has been in this study, because it is showing true results. And one of our favorite topics on this show is the importance of the endocannabinoid system. Now, you two are both experts and been studying the endocannabinoid system and medicinal cannabis for a lot longer than most people. Can you, and then we have some questions after this, can you summarize why the health, function, and signaling of the endocannabinoid system is also imperative for protecting our immune system and even in the prevention of the destructive inflammation that people experience with COVID-19?
So I'll start. The endocannabinoid system has been around for a long time. Endo means within your own body. And the plant uses the system, the animals use the system, the fungi uses the system. The time these three groups separated their ways goes way back. And part of the reason, if you look at it, is because the fundamental purpose of this endocannabinoid system is to detect stress and respond to stress, even at the plant, at the fungus level. And one of the key here is called G protein coupled receptor, GPR. GPR is one of the oldest such receptors, and it is very, anytime when you think the body devotes a huge chunk of the genetic material for this particular purpose, it has to be important. And G protein coupled receptor is one of these very, very, very ubiquitous and one of the most coding region occupying gene. Dr. Babin will tell you a little bit more about this. For example, GPR55 is a specific one, and that's G protein coupled receptor. The reason why you can look at us and we're all moving is because the G protein coupled receptor in the back of your eye gets the signal, renews the signal at a very rapid rate so that you can see this hand moving. Otherwise, you'd be seeing a static picture. And so this set of a signaling system, number one, is ubiquitous. It's all over the place. Number two, they're very, very important. Number three, they're ancient. And number four, we just happen to have the cannabis sativa plant that makes sort of a fake ligand that can bind. It's like a fake key. It's a fake key, but it does the job because it can open enough of the doors that the fact that we don't really understand the full picture. But what we can say is that it has probably more than 20 medicinal properties that are being explored, and this being one of them.
Wow. So for everyone listening, the ligands are the phytocannabinoids from the cannabis sativa plant and or the hemp plant. And they are not what we make, they're not identical to the endocannabinoids that we make in our body, but we get them from plants and they work on this huge G protein coupling receptor system. And the 55 that Dr. Yu was just explaining is also very abundant throughout the brain, which is very important since the brain sort of tells the body what's going on in that systemic and ubiquitous signaling. We do not want to lose that signal. We don't want to lose any. In fact, we only want to contribute to signaling. Is that a good way to summarize what you were sharing, Dr. Yu?
Yes.
Yep.
Yes.
Yeah.
And then just to add to that is the other thing is which is important to have the general health to maintain this good immune system and the role of the endocannabis system and also this receptor like GPR55 or TRPV1, which are the main one basically there. Remember both the endocannabinoid system, the receptor 2 on that one, which is indirectly get affected by CBD really in our body. And also these receptors, the GPR55 and other receptors really in our body, they are, as you mentioned, not only widely presented in brain, in lung, in gut, but also importantly, they are expressed on our immune cells. So certain majority of the immune cell express these receptors. So it's important that we know, first of all, to maintain a good immune system and general health in our body. That helps basically this uh, natural ancient system in our body works much more, effectively and in a, you know, fast, reaction to the potential threat or anything. So I just wanted to add that. Yeah.
I love it. It is an ancient system, and it's like having that wisdom that keeps things in balance, fully intact.
Absolutely.
So that, because this is not the only stress that we're experiencing right now, there's always internal and external stresses. So this system is really important so that the systems that are being attacked, like the immune system, have a better chance with phyto and endocannabinoids to do the right thing.
And the other thing about immune system, which is important in connection to endocannabinoid system and the cannabinoid in general, the immune system is very diverse. It is, and it has a very specific feature and characteristic that when one part of it is overworking or overdoing things, the other parts try to bring it down, basically, try to control it. It works on the compensation to bring back the balance. So endocannabis system and cannabinoid, as they mimic this endocannabis system, basically, they are important to facilitate and to basically re-amplify this regulatory system, help the body. So that is another advantage of this system if it is applied at the right time, right dose, and time and dose is very important. Yes.
This is so important because I love that you just explained how the body compensates.
Yes.
And to make sure that compensation is not destructive, this system is really key to having all these fluctuations going on internally and externally in balance. And that's really what we're looking for. We're not going to avoid getting sick all the time. We're not going to avoid stress, but how our body deals with it in a lack of compensation. Too many of the good guys, too many of the bad guys, your guests coming in and destroying your house, furniture, and health, or an overcompensation. Good intentions, bad outcome. I've got one question for you guys, for the doctors, before we close this off, because your time is valuable. And like, I just really want to express what they've done here is pioneer how CBD works for COVID-19 in the immune system. Please check out their study. And in closing, we have a question. She says, I'm taking hydrochloroquine. Did I say that correctly?
Hydroxychloroquine.
Hydroxychloroquine for psoriatic arthritis and Lyme disease. I take zinc and D3 regularly and use CBD. Is this helping per all of these? Are they help protecting her from COVID-19? Is hydro, can you say that, Brett, one more time?
Hydroxychloroquine, yeah.
Does that go hand in hand with your study? Is that something that people should be looking into also, if they can get it as a prescription?
Well, I'll start. And the body is a complex system. We actually call it CAS, which stands for CAS, Complex Adaptive System. There are a whole bunch of components that all work together, affecting and being affected by the other components. So it is a very, very difficult thing to sort out, and it's highly unlikely an individual element is going to have a massive, overwhelming effect. But it looks like the cannabidiol achieved some of that. The hydroxychloroquine is given to people with malaria or people with autoimmune issues. It changes the acidity inside the vesicles that process these protein and then re-express it out. So when you mess with the body's ability to sort of present their ID and let people know that, hey, I have the problem, you will suppress the autoimmune problem. So it works in the, psoriatic arthritis or systemic lupus erythematosus and those kind of conditions. We do not have solid data to show that hydroxychloroquine has real effect in COVID-19 patient, although they are units that will give this medication because there's not a whole lot. The other medications are like remdesivir, which we do know will interfere with the viral duplication, or steroids, which accomplish similar things to cannabidiol. And that's why in our new experiments, we're going to do face-to-face comparison, checking if the steroids given through the lungs will be better than or worse than cannabidiol. Zinc is a big metallic ion. It will take up a lot of the space, so that it's a cofactor in many, many enzymes. And it is one of those, so people throw the kitchen sink at this thing, and it's like a whole ball of spaghetti onto the wall and see which one sticks. The problem is that you don't know which one works. And those kind of combination is not uncommon. And vitamin D is a key one to restore between autoimmunity and lack of immune response. So vitamin D, zinc, hydroxychloroquine, all those are frequently given with vitamin C or some other kind of cocktail. But we do not know, because if you want to do controlled experiment, you will require a lot of individuals, or what we call the sample size has to be very high.
Thank you. Doctors, if people have questions or they want to find more of your studies, is there a way for them to contact you or look at your research? You also have a really fascinating research on whole body vibration and the microbiome in diabetes. Is there a website or an email that they can connect with you through?
Yeah, feel free to email us. We are teachers at heart, so ultimately we aim to explain, to disseminate the knowledge.
I will put your emails in the link under the Facebook Live.
Absolutely.
Everyone, thank you for listening. Remember, this is a serious and sensitive topic. Our intention today, which I think these doctors have pioneered, which is why I call them heroes, in the study of CBD and COVID-19, is groundbreaking. We know the results: reduced inflammation, reduced structural damage, improved oxygen. So please remember, it's not one thing like Dr. Yu just explained. It's a whole host of things. Protect yourself, keep your endocannabinoid system healthy, functioning, signaling, and be kind to yourself. Reduce stress, get sleep, don't eat too much. Intermittent fasting, like we were talking about. All of these things will help and go a long way to not only not getting it, but if you get it, having the symptoms be mild. That's what we want, is for everyone to be safe and to enjoy their health. Join our team. Please follow us on Facebook and IG. And thank you from my heart and soul to yours, doctors, for being here and sharing your wisdom and expertise. Thank you so much.
Thank you.
Thank you. Thank you.
Have a great day.
You too. Thank you again. Bye, everyone.
Okay, thank you.